Hello beautiful people, welcome back to the channel. Today's video we are going to be exploring Conifer Health Solutions. So Conifer has multiple positions open and I wanted to do a video that is just focused on them today. So they have coder roles, they have denials, administrative type of positions open as well. They have customer service, really well-rounded. So we're going to just explore a couple of them. Let's talk about this first one, which is the Inpatient Coder. This is a fully remote opportunity. This is one that they are constantly hiring for. So you're going to be reviewing medical records. You're going to be helping to determine and making sure that assignment of billing codes to specific medical procedures, that they align, that they are accurate. So really just focusing on that. That's what this role is. Knowledge of DRG, so which is different CMS methods of reimbursement. So really essential to be successful. You do need to have that type of background. They also talk about REIT or RIA. So these are common certifications with coders. So they are asking for those, and then 1 to 3 years experience performing inpatient coding in acute care setting environment. So high school diploma or GED, associate's degree or bachelor's is something that they prefer, but it's not required. So even if you don't have that, you can still potentially apply and get this position. And then the second position we're going to be exploring is another position, which is a coder reviewer. So this is slightly different because for this particular one, you are going to be focusing on actually reviewing the work of the coder. So you are going to be making sure that before things are billed, before services are billed, you're kind of that in-between process, making sure that the coder has actually done their due diligence, they've done all the work, and you're just making sure, verting what they've done to ensure that they've done appropriate billing, they've done appropriate matching of codes to corresponding reimbursement policies, corresponding reimbursement numbers, and so forth. So that's what this position really is about. As you can see on here, they are asking for a little bit more number of years of experience. You see on here 3 to 5 years. They are also asking for high school diploma, like similar to the other roles, and preference is still in bachelor's in healthcare or health information, nursing, or any type of related healthcare field. So that is something that is still very needed, but however, it's a preference. So if you have a bachelor's degree, even if it's not in any of these areas, that still gives you a leg up versus somebody that doesn't. All right, so now that we've talked about that, we're going to move on to the next opportunity. With this though, I do want to quickly just talk about coding in general. Medical coders tend to earn between $25 and $30 per hour. That's just the average. And with Conifer is a little bit above the average. So just keep that in mind as you make your decision towards applying and making sure it's a good fit for you. Obviously, depending on where you're located, that's also going to play a factor in what you get within that bracket. We're going to move on to the next role, which is a denial specialist. So denial specialist is a position that I am quite familiar with. I have done it in my career in healthcare. And with this position, really what you're doing is you're focusing on the denial rates of the organization. And this specifically happens with, health insurance or even car insurance. There's always that individual that focuses on what are some of the trends, what are some of the probability of the organization denying services because maybe for one reason or another, specifically healthcare, maybe a prior authorization was not put in place, or in some cases, maybe certain services were deemed medically unnecessary is why they were denied. So there are many reasons why services get denied. So this individual has to be a SME in that area. So you're responsible for validating dispute, like I mentioned, explanation of benefits. Having that knowledge can be very beneficial. Someone who is able to easily validate and confirm any type of inaccuracy within the benefits of the submitter or the patient and so forth. So really just looking through all the payments, ensuring that services that were authorized are actually being paid, and also verting the provider side as well, making sure that if they are in contract, they are not supposed to balance bill the member, etc. etc. So that is really what this position is. You are being expected to have some understanding of explanation of benefits, managed care organization, managed care contracts, so like health insurance companies, basically understanding of state and federal laws. Like some states on the federal level, you are not supposed to balance bill someone with an HMO plan versus a PPO plan. So those are some of the rules, and every provider office knows this rule, but occasionally you still have a few people that want to slip through the cracks. So this individual has to kind of be that person that brings them back and say, this is how the law suggests we address this, so we need to stick within that expectation. So they also want you to have some intermediate level knowledge of Microsoft Office, just Microsoft's products and skills in general, Word, Excel, PowerPoint, etc. Someone who has a very good business letter writing skills. That's important. That makes sense, right? Because you're going to be sending a lot of emails. You're going to be conversing with people outside of the organization. So it's really essential for you to be able to have a very good diction, be able to put some language together that is acceptable. All right. High school diploma or some college education equivalent is what you're looking for. 3 to 5 years experience in hospital business environment is another requirement for this role. And with this position, they do have a compensation here. It's between $17 and $25 per hour. That is the salary for this one. So they do have that listed here. So we're going to talk about a few others that they have, and then I'm going to wrap up this video. But obviously, you know that you can definitely explore the cover page and be able to see many other opportunities that they have open. So I'm going to click on this one, which is the patient account representative role. This is more of a customer service opportunity. As you can see, you will be responsible for helping customers navigate any type of issues they may have, whether it's application related, whether it's system related. In some cases, is it about their bills, or are they just looking to vent, or is it an interaction they had with a provider? Whatever the case may be, this individual is frontline to help navigate any type of issues the customers may have. You'll be performing a lot of research. You're going to be helping to bring some understanding to customers as well. Sometimes there are confusions around benefits. Helping them navigate all that is what this role primarily is about. With this position, the salary is on the lower side, is between $14.50 and $21.80. So that is the salary they're offering for this one, but they do have quite some benefits. I know I didn't call it out at the beginning, but they do have some on here. As you can see, they do match up to 6% for 401k. They offer it, which is a good thing. They also have 10 paid holidays per year. They have paid time off, which you have about 12 of them. So if you include both together, that's the total of 22 days off for the year, which is not bad. So they do have quite some benefit. There's medical, there's dental, vision, disability, life insurance, health savings account, flex account. All of that is part of coverage or the benefits that Conifer Solutions offer. They're asking for a high school diploma or equivalent. I think I talked about this before. In addition, they are asking for typing speed 45, which is a little bit higher. So typically 35 is the minimum. So they're asking a little bit above average, but it's 45 words per minute. I know I've done a video in the past where I provided you with resources to help you build your typing skills. That is one additional requirement that they are asking for, and the more you type, the more you work on it, the faster you get in actually typing. So that is something from experience that I can actually share. So if you feel you are not there yet, please continue to practice. You will get there, I guarantee you. All right, so they talk about having state requirements, knowledge, Medicaid, Medicare, etc. That is important because especially with regards to requirements, reimbursements, etc. So if people, like I mentioned, for example, balance billing, right, which is a federal law. So without the customer service rep having such knowledge, a member can call in or a patient can call in complaining, and you necessarily would not know what to do. Versus if you do, then you can just say, please go back to the provider and make sure you let them know this is a federal law, that they are violating a federal statute, that they are not supposed to balance bill you because you have an HMO plan. So you can easily do that, and that way you're basically cutting a lot of steps and you're helping that customer out. So having those type of knowledge can be very very helpful. Obviously, the more you do this, the more experience you have under your belt, the higher your knowledge in all of these statutes. So just keep that in mind. So give yourself some grace. All right. That is the last opportunity I wanted to go over in this video. So as I mentioned before, Conifer has quite some roles open right now. So definitely go ahead and explore their career page. I will drop the link in the description of this video, as well as specific or direct links to the other roles that I've talked about, so that you can go right into them. If you have any questions, please come back, leave it in the comment section. I really want to hear from you guys. If there's anything, any topic in particular you want me to explore, please let me know. I appreciate each and every one of you for being here. Till next time, I wish you all the very best of luck, and I will catch you in the next video. Take care, guys. Bye bye.